Imagine spending years believing that walking, lots of walking, is the golden ticket to a long, healthy life, especially as we get older. We see all those articles, hear the advice from friends, and even doctors, just keep moving. But what if I told you that for some of us, pushing through those daily steps, especially when dealing with certain health conditions, might actually be doing more harm than good? It's a tough truth to face, isn't it? The very activity we cherish for its simplicity and accessibility, the one we rely on to keep our hearts strong and our bodies limber, could unknowingly be working against us. This isn't about discouraging movement, not at all, but about understanding that our bodies change, and what was once universally good advice might need a thoughtful adjustment. The painful reality is that for many older adults, continuing to walk the same way, or pushing past pain, could be accelerating wear and tear on joints, straining an already delicate heart, or even increasing the risk of dangerous falls. It's a silent struggle for many, feeling pressured to keep up, even when their body is sending clear signals to slow down or adapt. In this video, we're going to dive deep into specific health conditions where walking less, or modifying how you walk, isn't a sign of weakness, but a smart, proactive step towards greater longevity and better heart health. We'll look at conditions that might make you rethink your daily stroll and explore safer, more effective ways to stay active. Stick with me until the very end because there's something important, something truly surprising, that you absolutely need to hear about protecting your health as you age gracefully. Let's gently ease into the first situations where rethinking your walking habits becomes incredibly important. We're talking about conditions that often come with age, ones that impact our very ability to move without discomfort. The first one that often comes to mind, and for good reason, is severe osteoarthritis, particularly when it affects your knees or hips. Now, for years, we've been told that movement is medicine for arthritic joints, and in many cases, especially with mild to moderate arthritis, that's absolutely true. Gentle movement helps lubricate the joints, strengthen the surrounding muscles, and reduce stiffness. But here's where the nuance comes in, and it's a crucial one when osteoarthritis reaches a severe stage, marked by significant cartilage loss and bone-on-bone friction. The very act of repetitive, weight-bearing impact from walking can paradoxically become detrimental. Imagine the cartilage in your knee as a natural shock absorber, a smooth, slippery cushion that allows your bones to glide effortlessly. With severe osteoarthritis, that cushion is largely gone, leaving the ends of your bones to rub together. Every step, every pound of pressure through that joint creates friction, inflammation, and micro-damage, pushing through significant pain. Believing it's just stiffness or part of getting older can actually accelerate the degeneration, making the pain worse and potentially hastening the need for more invasive interventions like joint replacement surgery. The painful reality for many is that they're trapped in a cycle they walk because they believe it's good for them. But the walking itself exacerbates their pain, leading to less mobility in the long run. It's a heartbreaking situation, feeling like you're doing the right thing, only to find it's making your body ache even more. So, what's the thoughtful approach here? It's about being kind to your joints instead of striving for long, continuous walks on hard surfaces. Consider reducing the duration or frequency of your weight-bearing walks. Shift your focus to activities that support your joint health without the high impact. Think about spending time in a swimming pool, where the buoyancy of the water takes the pressure off your joints while still allowing you to move and strengthen muscles. Water, aerobics, gentle swimming, or even just walking in the shallow end can be incredibly therapeutic. Another excellent option is a stationary bicycle or a recumbent bike. These allow for smooth, controlled motion in your knees and hips, improving circulation and flexibility without the jarring impact. Chair exercises, where you focus on strengthening your leg and core muscles from a seated position, are also fantastic for building support around the joints without putting direct stress on them. The key is to listen intently to your body. If a certain activity causes sharp, persistent pain that lingers long after you've stopped, it's a clear signal to adjust. Consult with your doctor or a physical therapist. They can help you design an exercise plan that nourishes your joints, rather than wearing them down, ensuring you maintain mobility and reduce pain for years to come. This isn't about stopping movement. It's about choosing smarter movement. Well, now, let's turn our attention to another critical area where the more walking is always better. Philosophy needs careful reevaluation advanced heart conditions, particularly conditions like congestive heart failure or unstable angina. Our hearts are incredible organs, tirelessly pumping blood throughout our bodies. But when the heart is weakened or diseased, as in heart failure where it struggles to pump efficiently, or with unstable angina where blood flow to the heart muscle itself is dangerously restricted, every bit of physical exertion places an additional burden. For someone with a compromised heart, pushing too hard can be incredibly risky. It can lead to shortness of breath, chest pain, dizziness, or even, in severe cases, a cardiac event. The painful reality here is that the very activity meant to keep the heart strong could, for some, trigger a crisis. It's a terrifying prospect, knowing that a simple walk could push your heart past its limit, leaving you breathless and fearing for your health. Many feel a deep sense of guilt or frustration, seeing others easily enjoying walks that feel impossible or even dangerous for them. So, how do we navigate staying active when our heart requires such delicate care? First and foremost, under the guidance of your doctor. This is not a situation for self-diagnosis or pushing through. For individuals with advanced heart conditions, the focus shifts from endurance, walking, to gentle, consistent, and carefully monitored activity. Think very short, frequent bursts of low-intensity movement, rather than one long walk. Perhaps a 5-minute stroll around the house a few times a day. Or gentle chair-based exercises that elevate your heart rate only slightly, without causing strain or discomfort. The goal isn't to break a sweat or get out of breath, but to promote circulation, maintain muscle tone, and keep your body moving in a safe, controlled manner. Many cardiac rehabilitation programs offer supervised exercise environments where professionals can guide you through appropriate activity levels, teaching you how to monitor your heart rate and recognize warning signs. The concept of perceived exertion becomes vital here. Knowing how hard your body feels it's working on a scale of 1 to 10. For advanced heart conditions, you'd want to stay at a very low level, perhaps a 2 or 3 where you can still comfortably hold a conversation. Rest periods are just as important as the activity itself. Allowing your heart to recover fully. Never ignore symptoms like chest pain, severe shortness of breath, lightheadedness, or sudden fatigue. These are your heart's way of telling you to stop and rest immediately. It's about listening to your body's unique rhythm, respecting its limits, and working with your heart, not against it, to sustain its function for as long as possible. Understanding these boundaries isn't about giving up on activity. It's about embracing a form of movement that truly supports your heart's longevity. Now that we've carefully considered how severe osteoarthritis and advanced heart conditions might reshape our approach to walking, let's continue exploring other vital areas where less or modified walking can be a true act of self-care and preservation. Our next focus is on individuals living with severe peripheral artery disease, or PAD, especially when it causes significant claudication. PAD occurs when arteries that supply blood to your limbs, most commonly your legs, become narrowed and hardened due to plaque buildup. This restricts blood flow, and when you walk, your leg muscles demand more oxygen-rich blood than the narrowed arteries can deliver. This imbalance leads to a distinct cramping pain, numbness, or weakness in your legs, often in the calves, thighs, or buttocks. This pain, known as claudication, typically eases when you rest and returns when you resume activity. While walking is a crucial part of rehabilitation for many with PAD, helping to stimulate the growth of new blood vessels. The painful reality for those with severe PAD is that pushing through intense claudication can be incredibly debilitating and, in some cases, counterproductive. Imagine trying to walk, but with every step, your legs feel like they're encased in concrete, burning and aching, forcing you to stop. It's not just uncomfortable, It's genuinely agonizing. And the constant fear of pain often leads people to become increasingly sedentary, which only worsens the condition in the long run. Many feel a deep sense of frustration, wanting to be active but finding their own body betraying them with intense pain, making even simple errands a huge challenge. The idea of just walking more feels like a cruel joke when your legs are screaming in protest. So, how do you manage activity with severe PED? The approach isn't to stop walking entirely, but to walk smarter. Instead of trying to power through long distances, the recommended strategy is often known as walk, rest, walk. You walk until you feel the onset of discomfort or pain. Then you stop and rest until the pain subsides completely. Once the pain is gone, you resume walking. This cycle is repeated. The goal is to gradually increase the total distance you can cover over time by slowly extending the walking intervals and shortening the rest periods, but always respecting the pain threshold. For severe cases, this might mean starting with very short walking bursts, perhaps just a minute or two, followed by several minutes of rest. Supervised exercise programs, often within a physical therapy setting, are invaluable for PAD patients. Under professional guidance, you can safely push your limits slightly, improving circulation and muscle endurance without risking harm. Beyond walking, gentle leg exercises like ankle pumps, calf raises while seated, and controlled leg lifts can help improve blood flow and muscle strength without putting undue stress on your arteries. Lifestyle changes, like quitting smoking, managing diabetes, and controlling cholesterol, are also paramount to slowing the progression of PAD. It's about being strategic with your movement, nurturing your circulation rather than overwhelming it. Let's move on to an equally critical concern: significant balance issues and a high risk of falling. As we age, various factors can contribute to impaired balance neuropathy, which causes nerve damage and reduced sensation in the feet, Parkinson's disease affecting gait and coordination, inner ear issues, certain medications that cause dizziness or drowsiness, and general muscle weakness. For many older adults, walking, especially on uneven surfaces, in dim lighting, or when hurried, becomes a perilous activity. The painful reality for those with significant balance problems isn't just the physical discomfort, it's the constant, gnawing fear of falling. Every step can feel like walking on thin ice, leading to anxiety, reduced confidence, and ultimately, a self-imposed isolation as they avoid activities that might lead to a fall. A fall can lead to fractures, head injuries, and a devastating loss of independence, sometimes requiring long-term care. This fear is a heavy burden, often unseen, shaping daily decisions and limiting a vibrant life. For this group, the advice isn't necessarily to stop walking, but to ensure every step is as safe as possible and to prioritize balance and strength training over simply logging steps. First, address the underlying causes with your doctor. Review your medications, get your vision checked, and discuss any neurological symptoms. For safe movement, consider using an assistive device like a walker or a cane, especially outside the home or in unfamiliar environments. These provide crucial stability and a sense of security. More importantly, focus on specific exercises designed to improve balance. This might include standing near a sturdy counter and practicing heel-to-toe walking, standing on one leg for short periods, or engaging in Tai Chi, which is renowned for its gentle movements and focus on balance and body awareness. Strength training for your legs and core muscles is also vital, as stronger muscles provide better support and reaction time if you stumble. Physical therapists are experts in fall prevention and can create personalized exercise programs and advise on home modifications, like removing tripping hazards and improving lighting, to make your living space safer. It's about building a stable foundation, both physically and in your environment, so that any walking you do is purposeful, confident, and minimizes risk. It's not about being less active, it's about being strategically active. Finally, we need to talk about severe spinal stenosis and sciatica. Spinal stenosis is a narrowing of the spaces within your spine, which can put pressure on the nerves that travel through the spinal column. Sciatica, often a symptom of stenosis or a slipped disc, involves sharp, shooting pain that radiates along the path of the sciatic nerve, typically down one leg, often accompanied by numbness or tingling. For many with these conditions, standing or walking, especially standing upright, can significantly aggravate their symptoms because it increases the compression on the nerves. The painful reality is that a simple stroll can turn into an agonizing ordeal, forcing people to lean forward or stop frequently for relief. This pain isn't just annoying. It can be excruciating, limiting everything from doing household chores to enjoying a simple walk with loved ones. It dictates life, often leading to a sedentary existence to avoid the inevitable flare-ups. So, for severe spinal stenosis or sciatica, what's the tailored approach? Often, people find relief by walking in a slightly forward-leaning posture, which can open up the spinal canal and reduce nerve compression. Using a walker or even leaning on a shopping cart can provide this forward lean and allow for more comfortable, albeit limited, movement. The focus should shift from long-distance walking to exercises that decompress the spine and strengthen the core muscles that support it. Gentle stretching, particularly exercises that involve bending forward slightly, can provide relief. Aquatic therapy, where the buoyancy of water supports your body weight, allowing for pain-free movement and strengthening, can be incredibly beneficial. Low-impact activities like stationary cycling in a reclined position are also often well tolerated. Avoid prolonged standing or walking without breaks. Listen to your body's signals and stop before pain becomes severe. A physical therapist can teach you specific exercises and postures that decompress your spine and alleviate nerve pressure, helping you regain comfort and mobility. It's about finding intelligent ways to move that respect your spinal health, allowing you to live with less pain and more freedom. It's a complete shift in perspective, moving from an assumption that all walking is good to understanding that for certain conditions, different movements are truly life-enhancing. We've journeyed through some truly important considerations today, understanding that while walking is a wonderful gift, its benefits aren't always universal, especially when our bodies are navigating specific health challenges. We've seen how for those with severe osteoarthritis, particularly in the knees and hips, reducing high-impact, repetitive walking and embracing gentler movements like swimming or cycling can be a true act of joint preservation. For individuals managing advanced heart conditions, the message shifts to short, low-intensity, and carefully monitored activity, always under a doctor's watchful eye, ensuring that movement supports, rather than strains, a fragile heart. And we discussed how severe peripheral artery disease doesn't mean giving up on movement, but rather adopting a strategic walk-rest-walk approach, alongside supervised exercise programs, to nurture circulation and build endurance without overwhelming painful limbs. We also explored the critical importance of prioritizing balance training and safe, assisted movement for anyone facing significant fall risk, transforming fear into confidence through targeted exercises and environmental adjustments. Finally, we looked at how those with severe spinal stenosis or sciatica can find relief and maintain mobility by adapting their posture and embracing activities that decompress the spine, moving away from activities that aggravate nerve pain. The core message here isn't to stop moving. It's about moving smarter, with greater awareness and intention. It's about listening to the unique signals your body sends, rather than pushing through pain or discomfort that could be a warning sign. Our bodies are incredibly resilient and adaptive, but they also change with time, and our approach to exercise needs to evolve alongside them. This isn't about giving up on an active lifestyle. It's about refining it, tailoring it to fit the incredible, unique person you are today. It's about understanding that longevity and heart health aren't just about quantity of steps, but about the quality and appropriateness of your movement for your current health status. Remember, even small adjustments, when they are the right adjustments for your body, can make an enormous difference to your comfort, your safety, your overall health, and most importantly, your happiness. It's completely natural to feel a bit surprised by some of these insights, especially when we've been hearing a different message for so long. But true wisdom often comes from questioning assumptions and seeking out what truly serves us best in our current season of life. You are your own best advocate, and educating yourself on these nuances empowers you to have more informed conversations with your healthcare providers, leading to a truly personalized approach to your well-being. There's no one-size-fits-all solution when it comes to healthy aging. And embracing that individuality is a powerful step forward. Don't let past advice hold you back from finding the most beneficial path for your body right now. Now, I'd love to hear from you. Have you found yourself in any of these situations? Have you had to adjust your walking habits due to a health condition? What insights or strategies have worked for you? Share your experiences and thoughts in the comments below. Your stories could genuinely help someone else who might be struggling with similar challenges, reminding us all that we're part of a supportive community. It's through sharing our journeys that we learn and grow together. If you found this video helpful, insightful, or even just thought-provoking, please do give it a thumbs up. Liking the video tells me that this kind of detailed, nuanced health information is valuable to you, and it helps more people like us discover this content. And if you haven't already, consider subscribing to our channel. We're dedicated to bringing you more practical, evidence-based, and encouraging advice designed specifically to help you live your healthiest, most vibrant life at every age. We're building a community here focused on empowering you with knowledge and practical tips, always aiming for a balanced and realistic approach to health and well-being. Remember, every day is an opportunity to make choices that honor your body and support your long-term health. Be kind to yourself. Listen closely to what your body needs, and never stop learning about how to best care for it. You deserve to feel your best, to move with comfort and confidence, and to live each day with vitality and joy. Live your best life at every age, embracing informed choices and a path that truly nourishes your unique journey.